Good afternoon, and we welcome you again to our National Emergency Operations Center COVID-19 weekly briefing for Wednesday, the 18th of August, 2021. We thank you very much for joining us, as usual, as we continue to update you with what is happening in St. Kitts and Nevis in relation to the management of the COVID-19 pandemic. I am your host, Lesroy Williams. Today I want to invite Leonie James, who is the coordinator for the National Intercessory Network, and she will make a donation to the NEOC. Ms. James. Ms. James is not here. She will make the donation virtually.
National on 20th of June 2006, that network was called WINN. The focus, back fathers, that is to their rightful place. Parenting to save youth at risk. Then, secondly, we looked at church. Since there were persons involved like Pastor Judah Payne. Third, government justice. Fourth aspect was the workforce, that is all involved in areas of work. Makers. Lastly, health. It is said a nation's health is wealth. Family, others, board, and many persons were involved. Monthly meetings were held. Interestingly, one year formed a group. Now we look at funding. Members gave generously because there were different needs that we would have to see about. Years ago, God put a hold on the meetings, and this was because the mission that we set out to perform was accomplished. This nation, the smallest in the hemisphere, has famous accomplished across the world. For example, we look at Kim Collins. This afternoon, this group, NIN, will present a gift in a check, the form of a check for $6,118.32. And this is for the fight against COVID. That is my presentation this afternoon.
Ms. Leonie James, who just made a donation to the NEOC of $6,118.32. And that donation was made towards the fight of the COVID-19 pandemic here in the Federation. Thank you very much, Ms. James. I now invite Superintendent Cromwell Henry to present us with the law enforcement report.
Thank you, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. Since the removal of the requirement for private security for home quarantine, we have seen a significant increase in the number of persons applying for this option. The removal of the requirement for private security is another easing of the restrictions that were imposed previously to control the spread of the virus. The quarantine period for fully vaccinated persons is 4 days. You will be tested on day 4, and your results should be returned within 24 hours. There may be some delay, however, if day 4 falls on a Sunday, as the lab is usually closed on Sundays. Persons in quarantine shall only be released from quarantine upon receiving a negative RT-PCR test. Quarantine is a public health measure used to separate and restrict the movement of persons who may have been exposed to a communicable disease, such as COVID-19, or travel from a country that is considered a hotspot for the virus to see if they will eventually become ill. In addition to incoming travelers quarantining at home, there are a number of persons without a travel history, but who may have had contact with a person who is positive with the coronavirus, being placed in quarantine at home by the health authorities. The same conditions would apply to both groups of persons. You are expected to remain at the approved residence and avoid physical contact with other persons. You are permitted to have food or other supplies delivered to the residence, but again, these deliveries should be contactless. Persons who are in quarantine and become ill or otherwise wish to seek medical attention, you should either contact your personal physician via phone or call 311 or 911 for emergency medical assistance. Under no circumstance should you use the regular public transportation to seek medical assistance. For incoming travelers, on day 4 of your quarantine, you will be required to travel to the Bastia Health Center or other testing site via travel-approved taxis only, or you may drive yourself if you have a vehicle for the purpose of doing your exit tests. Other persons who are in quarantine will be visited at their residence by the mobile testing team to be sampled. Given the prevailing situation with new cases in the Federation, the police have adopted a zero tolerance for breaches of quarantine conditions. Section 7 of the Quarantine Act provides the following. Any person who refuses or willfully omits to do any act which he or she is required to do by this act, or refuses or willfully omits to carry out any lawful order, instruction, or condition made, given, or imposed by any officer commits an offense and shall be liable on summary conviction to a fine not exceeding $5,500 or to a term of imprisonment not exceeding 6 months, or to both such fine and imprisonment. We have used this piece of legislation in the past with respect to persons who have breached their quarantine, and we are prepared to use it again should person breach any of the conditions of their quarantine. So again, we ask persons for their fullest cooperation in complying with all the conditions of their quarantine. Remain at home, do not have visitors at your home, do not come in contact with any person who is not in quarantine at the home, and always, when you're out, follow all the protocols. Wear your mask and maintain your social distance. Thank you.
Thank you, Superintendent Henry. We also thank the Honorable Wendy Phipps for joining us today for this briefing. She is the co-chair of the Disaster Mitigation Council. I now invite Dr. Marissa Carty, who is filling in today for the Chief Medical Officer, Dr. Hazel Laws, and she will present us with the Health Emergency Operations Committee Situation Report.
Thank you, Mr. Williams, and a pleasant good evening to all who are viewing and listening. This evening, I present the Health Emergency Operating Committee Situation Report for Wednesday, August 18th. This evening, I begin by reminding us all about the COVID-19 protective measures and behaviors, which includes wearing a face mask appropriately covering both the nose and the mouth, sanitizing your hands with soap and water or an alcohol-based sanitizer, maintaining a safe distance of 6 feet or more from persons with whom you interact, boosting your immune system, and staying at home when ill or ordered to do so. These measures are effective in reducing the impact of the pandemic. The response to the COVID-19 pandemic continues here in the Federation of St. Kitts and Nevis. During the period May 19th to August 18th, we have seen an increase of 663 cases, confirmed cases, of which 545 persons have recovered. There are currently 115 active cases with 7 hospitalizations and 3 COVID-19 related deaths. The map currently shown on the screen indicates the parishes most affected by the COVID-19 cases as of August 18th. Please note that it is the more densely populated areas that are most affected. Therefore, to summarize our current situation, the Federation has a total of 708 confirmed cases of COVID-19, with 683 cases in St. Kitts and 25 cases in Nevis. 590 cases have fully recovered. We now have 115 active cases, 7 hospitalizations, and 3 COVID-19 related deaths. Our contact tracing efforts continue. During the period May 19th to present, approximately 18,392 samples have been processed in the Federation. Also, the vaccine program continues, and by the end of day, Tuesday, August 17th, 72.9% of the target population had received their first dose, and 61.5% of the target population had received their second dose. Persons who would have received their first dose of the vaccine between June 3rd and 30th are asked to return for their second dose, since 4 weeks or more would have elapsed since receiving their first dose. Please note that if you would have received your first dose by June 9th, 10 weeks would have elapsed, and so that you can go and receive your second dose now. Also, if you would have received your first dose as of the 16th of June, 9 weeks would have elapsed, and you are now able to go for your second dose. Please note that the current batch of vaccines will expire on August 31st. Pregnant women are at an increased risk of getting severely ill from COVID-19 and experiencing adverse pregnancy outcomes as preterm birth. It is therefore recommended for pregnant women to be vaccinated against COVID-19. In the Federation, the vaccine will be administered to a pregnant female upon submission of a letter from her obstetrician gynecologist granting clearance. The Federation has received the U.S. government's donation of Pfizer-BioNTech vaccines to Caribbean nations. The first of 3 shipments of 11,700 doses was received last Thursday, August 12th. Preparation has been made to receive, store, distribute, and administer these vaccines. We now have universal eligibility for vaccine administration, So therefore, persons 12 years and above will be able to receive the Pfizer-BioNTech vaccine. Our health and travel protocols have been updated. For fully vaccinated passengers entering the Federation, you will be required to remain either in a government-approved COVID-19 hotel or quarantine facility, or you may apply to be quarantined in your private residence for a period of 4 days. The COVID-19 test sample will be taken on day 4. The passenger will remain in quarantine for the period and will be released upon receiving a negative RT-PCR test. For non-vaccinated passengers, you will be required to remain in quarantine for at least 14 days in a government facility and shall be released in accordance with the provisions of the COVID-19 Act. Children under 18 who are traveling with their fully vaccinated parents will be subject to the same quarantine time as their parents. Additionally, a notice of quarantine will be issued to inbound passengers for which they have to sign on arrival in the Federation. The form outlines the length of quarantine stay and all quarantine regulations. But please note, on day 4, your sample will be taken between the hour of 7 a.m. and 8 a.m. And this will be done in St. Kitts at 3 locations: the J.N. France General Hospital, the Poxon Hospital, and the Mary Charles Hospital. In Nevis, the test will be taken at 2 locations: the Disaster Management Building and the Gingerland Health Center. Please note that you are required to use only COVID-19 certified transportation to drive to and from the hospital or testing site to have your exit sample taken. You must wear a mask, a face mask, and sanitize during this trip. There are currently 2 SARS-CoV-2 variants in circulation: the Delta variant and the Lambda variant. The Delta variant was first identified in India. It is one of several variants of concern as designated by the CDC and the World Health Organization. It is the most contagious version of the coronavirus thus far, and it is spreading rapidly worldwide. There are 5 important things about the Delta variant. 1, it is the most contagious, as I previously mentioned. It is spreading 50% faster than the Lambda variant, which was 50% more contagious than the original strain. Unvaccinated persons are at risk. Persons who are not fully vaccinated against COVID-19 are most at risk. The Delta variant can lead to hyperlocal outbreaks, whereby the virus will hop and skip and jump from one poorly vaccinated area to another. There is still more to learn about the Delta variant, but we must note that vaccination is the best protection against this variant. The AstraZeneca vaccine was 60% effective against symptomatic disease and 93% effective against hospitalization. The Pfizer-BioNTech vaccine is 88% effective against symptomatic disease and 96% effective against hospitalization. Living with COVID-19 requires adherence to the COVID-19 protective measures and behaviors. So as I close this afternoon, I will remind you again, as these are the measures that will help us to reduce the impact of the virus on our federation. Wearing a face mask, appropriately covering both the nose and the mouth, sanitizing your hands with soap and water or an alcohol-based hand sanitizer, maintaining a safe distance of 6 feet or more from persons with whom you interact, staying at home when ill or when ordered to do so, and finally, accept the vaccine and get vaccinated. For confirmed cases, boost your immune system in order to recover speedily. And this includes eating healthy, getting adequate hydration, rest, exercise, and of course, taking your multivitamins. The Delta variant is here and will be the cause of the next big surge in the Federation. But with preparation, we can mitigate its consequences. Let us all work together to reduce the impact of this disease. Stay safe, stay healthy. Thank you.
Thank you very much, Dr. Carty, for giving us that report. I now invite Mr. Abdias Samuel, the chair of the National COVID-19 Task Force and the National Disaster Coordinator at NEMA, to give us his report.
A pleasant good evening to all. And again, I want to start by thanking Ms. Leonie James for her contribution to the cause of fighting COVID-19. So to you and the team, we say thank you for exercising your national patriotic spirit and responsibility. And we will assure you that we will use that contribution for a worthy cause. I also want to take this opportunity to express our solidarity with the people and government of Haiti during this critical time for them. I have been in contact with Jerry Chandler. He is the Director for Civil Protection in Haiti. And we have been discussing many ways in which we can partner and assist each other. We should be meeting with the Haitian Association sometime soon. That is the Mitigation Council ministers and myself and the management of NEMA to discuss how we can support efforts there in Haiti. I also want to take this opportunity to send condolences to one of our team members who supports the National COVID-19 Task Force. Today we learn of the passing of a son, and we want to say to Ms. Javashti Batiste, Evelyn, that our thoughts and prayers are with you at this time. And may the good Lord give you strength, and know that we are here to support you during this difficult period for you. Ladies and gentlemen, regarding the pre-approved home quarantine, we are having a lot of challenges because it's a new initiative, and we have a lot of delays, and the delays are being caused by a number of factors. One of the factors being that persons are not uploading their vaccination card. In order for your home to be inspected or even considered, you must upload some form of identification and also your vaccination card. Once that is done, the officers who are vetting the process will be able to verify and confirm that you will qualify to have your home inspected as you are fully vaccinated, because that's the criteria for fully vaccinated inbound passengers, and then they will carry out the inspection. We are asking that you give a minimum of 5 days in advance in submitting your application so that the officers can have sufficient time to process and carry out the inspection and provide you with the necessary approvals once you meet the criteria. It's very important that you do that. If you don't have the vaccination card uploaded or sent via email to the COVID-19 task force at gov.kn, it's going to delay the process. Another factor that we are seeing is persons are applying for the inbound passenger, and they are putting their own name into the application. Then we have the inbound passenger calling and asking questions about their application. Please make sure that the inbound passenger is the person whose name is on the application. In the application, it asks for a point of contact. The person who is applying, you can put your name as the point of contact for that individual. Another factor that we are encountering is when the officers go to the homes for the inspection and they are calling the numbers that are on the application. These are the numbers of the passengers who are overseas. Therefore, some don't have no connectivity. So we are calling and calling and calling, and there is no communication. So if there is no communication, then the officers will not have access to the premises to be able to carry out that inspection. Therefore, if you are overseas and you are applying, please indicate who locally we can contact to have access to the premises to do the inspections. These are little things that sometimes may delay your application. Please note that we are not going to process any applications today for tomorrow. Please note we will not process any applications today for tomorrow. Please give a minimum of 5 days for the applications to be processed. Let me just clarify something, and that was just mentioned by Dr. Cathy and also Superintendent Henry. So the question is, if I don't have a personal vehicle, what must I do? And that is clear. You must call a COVID-19 certified taxi. Again, let me repeat, you must call a COVID-19 certified taxi. You must travel in one of those taxis to the testing site and have the taxi take you back home until you receive your results. Anything outside of that, you can be penalized. I am also pleased to announce to you that we will have our first inbound flight from the UK on the 3rd of October 2021. So our first inbound British Airways flight, as stated by the St. Kitts Tourism Authority, will be on the 3rd of October 2021, where they will have, this will be on a Sunday, and then they will have the second flight on the 10th of October. Then from there on, they will have a flight twice weekly on Saturdays and on Wednesdays, and this will start on the 16th of October. So all our citizens, residents, and those who like to visit St. Kitts and Nevis, I think this is great news. We have been receiving a lot of calls about travelers who have to go to Antigua or who have to go other countries to come into St. Kitts and Nevis from the UK. Now you will be able to come home directly. I also want to inform you, the general public, that we have met, the National COVID-19 Task Force has met with the Culturama Committee, and we are in the process of validating some of the recommendations to the amendments made to for the activities, upcoming activities in September. For now, we have seen that some great responsibility has been exercised in the recommendations made, and we will be giving our recommendations and approvals hopefully in the near future. We have also received recommendations from the Carnival Committee, and the Carnival Committee would have been given some advice in terms of looking at their virtual platform that was used last year, and also they were cautioned about promoting any activity without having received the appropriate approvals. And those recommendations were well received by the Carnival Committee, and we are pleased to know that they will be adhering to those recommendations, and also we will be working closely with them to ensure that we can have some safe activities if permitted. The Ross University Veterinary School of Medicine continues to show and demonstrate the confidence in our national response efforts. We were advised that they will have 164 new students arriving in country in October. 110 students are expected between the 1st to the 3rd of October, while 54 vet prep students should be expected to arrive between 8th to the 10th of October. We are rather pleased with the support that we continue to see from the Ross University Veterinary School of Medicine. Colleagues, citizens, residents, I want to thank you for the national response efforts in preparing for Tropical Storm Grace. I am confident of the system that we have. I am happy to see the way the general public supported and responded to the calls for caution during the time period in which we were threatened by Tropical Storm Grace. Again, the good Lord showed grace and mercy upon us, and the storm deviated further away from us. The weather conditions for St. Kitts and Nevis tonight will be partly cloudy with a 20% or slight chance of showers. Tomorrow, partly cloudy with with a slightly hazy at first, in the morning at first becoming cloudy, then late in the morning with a 60% or moderate chance of showers. So please be mindful of this information. Thank you very much for listening. And again, to you, Javashti Batiste, Evelyn, our thoughts and prayers are with you and your family.
I want to join as well in conveying my condolences to Javasti and her family on this very sad, at this very sad time. We have now come to the question and answers for this briefing. And the first question for today: there is a WhatsApp message being circulated in which the Honorable Wendy Phipps is being accused of deceiving the public into thinking that the rapid tests which Dr. Drew donated to government last year are no good. And now the same rapid antigen tests are being used by the cruise lines for the port calls to St. Kitts. The source of the criticism seems to be based on a release from the Chamber of Industry and Commerce that demands that government accept the same rapid tests from the cruise lines. Can you clarify if the tests Dr. Drew offered last year are the same as the ones which the cruise ships are using? Are all COVID-19 rapid tests the same? Please explain. The public wants to know. We are confused. Dr. Wilkinson.
Thanks for the question, Leslie, and I'm happy to explain. Now, for the testing of COVID-19, we have two main categories of tests. You have the antibody test and the antigen test. And the antibody tests are described as a rapid test because you can get the results within a few minutes. With the antigen test, you have the standard PCR molecular test, which is done in the lab. That can take several hours, and that is the gold standard, and those are the ones that we do. Or you also have the antigen test, which is a rapid antigen test. Now, I know I might be losing persons here, but let me start. So with the antibody tests, and those are the type of tests that were given to us last year when we made a decision not to use them. They test for proteins that are developed in the body when somebody becomes infected. So with the rapid antibody test, there are two types of proteins that will be developed if you got infected. You have IgM, which occurs at least 2 weeks after you were infected, and IgM, which appears about, and IgG, which appears about 3 weeks after you were infected. So if one were to use the rapid antibody test to screen for COVID-19, someone can be going around for 2 weeks spreading the virus before the test shows up being positive. And that is why we made a scientific decision not to use the rapid antibody test in our screening protocols. So when Dr. Drew came on the 25th of March, I think it was last year, with the rapid antibody test, we made a decision not to use it, not because it was Dr. Drew. It didn't matter who was bringing these tests. We decided not to use them. The antigen test, I think the first antigen test that was given emergency use authorization by the FDA was on the 9th of March last year, which is sometime after Dr. Drew would have come with the rapid, May, 9th of May, which was sometime after he would have come with the rapid antibody test. And even then, we said that we were not going to be using the rapid antigen test at that point in time, because when they first came out, the sensitivity and the specificity were not as high. Now, as time has gone by, these tests have become more and more sensitive and specific, in that if someone tests positive with the rapid antigen test, we know that they are positive. However, the sensitivity is not that great because there's no amplification. In other words, one can have a low viral load and test negative. And that is why if someone tests negative with the rapid antigen test, you would have to follow it up with the gold standard PCR test. Some of the cruise ships are using the rapid antigen test to screen persons who they suspect might be positive on board. And they are finding a greater and greater use for that purpose in the acute setting, screening for persons in small gatherings, etc., to see if they are positive. And this is something that we are considering using at this point in time as the science has evolved. This is completely separate and completely different from the rapid antibody test that we made a decision not to use last year.
Thank you, Dr. Wilkinson, for clarifying that. This question is for Superintendent Henry. If an application is submitted for a non-profit event organized by a community group, is there a fee, although it's a voluntary exercise and no funds are involved? This question is posed as a recent submission made by a community group for an event which does not involve making money or raising funds. The group received notice that payment is required to process the application. Please clarify.
Thank you for that question, Mr. Williams. The website clearly indicates that there's a small processing fee of $20 for all applications. Only schools and government institutions, government departments are exempted. So all applications requires the payment of a processing fee. Churches as well. School, churches, and government departments are exempted.
Thank you, Superintendent. This next question, in light of the imminent reopening of schools, and the recent surge in COVID-19 cases, could you provide a rationale for the delay in the administration of the Pfizer vaccine to children between 12 to 17 who are not eligible for the AstraZeneca?
That's why everything takes preparation. The Pfizer vaccine is completely different in terms of the preparation required as compared to the AstraZeneca. The AstraZeneca is stored in a regular refrigerator. You simply take it out and you give it to the person. The Pfizer vaccine is stored at minus 80 degrees. Then it has to be thawed up, placed in another refrigerator, minus 20, and then thawed again and placed in a refrigerator, the regular refrigerator, 4 degrees. The nurses are currently undergoing training in the process. They had 2 training courses with the Pan American Health Organization, and they're continuing that. The plan is first to start around about the 1st of September. And I believe that patience is a virtue, and we want to make sure that when we start, we'll start correctly, and we will make sure that our teenagers and above will have the appropriate dosing schedule, etc. And so I ask people to just hold train. The vaccine will be coming soon and will be administered.
Thank you. These 2 questions are from WINN FM 98.9. Will the Pfizer vaccine be administered to adults? Also, and if so, when? And of the 115 active cases, have any been vaccinated?
So you refer that we received 11,000 plus doses in the first batch, and we'll be getting another 20-something thousand doses later on. And this is more than enough to supply our teenagers. And the plan is actually to vaccinate anybody above the age of 12 with the Pfizer vaccine. So although we are speaking about the fact that the 12 to 18-year-olds have an opportunity now to be vaccinated, we are not limiting the Pfizer vaccine to that group. And so if you're 67, 77, 57, 25, and you want to be vaccinated, when the vaccine is being rolled out, you can get the Pfizer vaccine. What's the other part of the question?
The other part of the question is, of the 115 active cases.
Yes, well, I don't have any specific data on the 115 cases right now, but what I can tell you is that when we were looking at the trend, the majority of persons, more than 70+%, they were not vaccinated. And so the same way the CDC said that the pandemic is becoming a pandemic of the unvaccinated, we are seeing mainly persons in our community who were not vaccinated who are becoming infected. Yes, there is a small percentage of persons who are vaccinated who are becoming infected, but not necessarily getting the disease. And there's a big difference, because you can become infected, but you may not be sick. You might be asymptomatic. And so the fact that you can still pick up the virus even if you are vaccinated, what you need to know is that you will not have severe disease, and the chance of you dying from the virus if you're vaccinated is significantly reduced. And so I want to continue to encourage persons to come out and be vaccinated. Every time there is a surge in a country, we are hearing what's happening in the Bahamas. People ask, what are we going to be doing here? The thing you do here is to go out and get vaccinated, because once we have a significant proportion of the population vaccinated, we can prevent you from going to the hospital to end up on a ventilator, to end up with long COVID-19 symptoms. So please go out and use the best tool we have available, which is the vaccine.
Superintendent, this one is for you. Was the fee for security removed with respect to home quarantine? And the second question is for Mr. Samuel. Mr. Samuel, are you now saying that persons in home quarantine must take a COVID-19 taxi to the place of exit testing and not in their personal vehicle, as stated in the notes sent out with approval letters?
For home quarantine, there is no private security required, therefore there can be no fee. And I may answer Mr. Samuel's question for him. The persons who are going to get their exit test, they can go to the testing site via a travel-approved COVID-certified taxi, or they can drive themselves if they have their own private vehicle. But they cannot use irregular public transport.
Thank you, Superintendent. This next question: can someone quarantine in a home that has one occupant, separate bedrooms? Does the roommate have to quarantine as well?
As long as there can be a complete separation for the two parties, those who are in quarantine and those who are not, without sharing the same bathroom in particular, that would be given consideration.
I just want to add that at the heart of everything is personal responsibility. The task force cannot micromanage every single thing that happens with this pandemic. And so if, for example, you apply for home quarantine, the place will be inspected. And if we see that you have a completely separate bathroom, the person can comfortably quarantine in one part of the house, then you will be given permission. But the task force is not going to be coming to the house every 5 minutes to check to see whether or not you are following the instructions. This is where personal responsibility comes in. And so unless we all play our part, we can see a re-emergence of the virus. Personal responsibility again comes into you going forward and getting vaccinated. So I think that clearly answers the question.
Thank you, Dr. Wilkinson. These questions are from Von Radio in Nevis. Owing to the recent uptick in COVID-19 cases in the Federation and the confirmation of the Delta variant in one of the now recovered cases, can citizens and residents anticipate a partial lockdown, and or will there be a revision of the existing COVID-19 protocols in the Federation to control the spread of the virus if needs be?
I think a couple of weeks ago, right at this podium, I said that we needed to prepare for the arrival of the Delta variant, because it was not if, it was when it was going to arrive. And the best way we could protect ourselves is by getting vaccinated. I announced last night that one of the persons who was in quarantine, who came in as an inbound passenger, they tested positive for the Delta variant, and that person has since recovered. And so, yes, we can assume that that person was not allowed to spread the Delta variant into the community. And so right now, we don't have any factual evidence that the virus is in the community. However, we know it's inevitable because as persons continue to come in, it's only a matter of time before the Delta variant will arrive. And so at this point in time, we need to assume that it might be here and do what is necessary to contain it. And so the solution is not just lockdown. There are things that we can do. Wear a mask, hand sanitize, go out and get vaccinated, because if we have a significant proportion of our population vaccinated, we will not overwhelm our healthcare system, and that can take out the need for us going into lockdown. And so I don't think that's on the table right now. We need to make sure that we do what we can do to protect ourselves, and that's why I'm happy too that we can add to the equation the teenagers, the 12 to 18-year-olds who never had an opportunity to protect themselves. And so in September, when the vaccine is being rolled out, I expect to see parents and guardians bringing all of these persons forward so we can increase our threshold of immunity and move forward and open the country.
Thank you, Dr. Wilkinson. This next question is also from WINN Radio. The last population census was in 2011. Is it plausible for the government to use the 2011 statistics for reaching the 70% herd immunity threshold, as the figures may have increased?
We now have 73% of the adults with one shot and 61.7% who are fully vaccinated. The aim is not to stop at 70%. The aim is to get everyone who can be vaccinated, vaccinated. And so no matter what the population is, we continue to push to get these persons vaccinated. And so you see that we are getting close to 70% of the adult population vaccinated, but we'll continue to push, because if we can get to 90%, 95%, we would have a better threshold of immunity. So the plan is not to reach to 70 and stop. The plan is to continue to push to make sure every single person who can be vaccinated get vaccinated.
Dr. Wilkinson, I will call you back up again to answer this question from WINN Radio, but it's really, will you make the Pfizer vaccine mandatory for students returning to high school at the tertiary level? Please, Dr. Wilkinson.
I don't think that I make the rules in the country at all. And so I cannot determine whether or not something is going to be mandatory or not. The most we can do is appeal to person's sense and sensibility and make sure that we let them know what are the pros and cons and encourage them to move forward. I believe that without a mandate, we have gotten a significant proportion of the population vaccinated already, and we'll continue to educate and to encourage persons to move forward and do the right thing. But I believe in terms of making a mandate, that is above my pay grade.
Thank you. This next question, someone is asking if there is a tentative date for the rollout of the Pfizer vaccines. September 1st. Dr. Wilkinson did say September 1st. Superintendent, who will know whether I traveled in my vehicle or public transportation to the home quarantine site? Who is policing this?
Again, as Dr. Wilkerson would have said, we have to rely on persons' personal responsibility. You know the risk involved in using the regular public transportation, and so we do not expect that persons will put the public at risk and go in use public transportation. However, the persons at the site, the nurses at the site, at the testing site, they will be on the lookout for the mode of transportation that persons would use. And if they suspect that you did not come in your own vehicle or you would have used transport that is not approved, then that will be reported. They will not test you, and that will be reported, and appropriate action will be taken. So we want persons to take the responsibility serious and do not expose the public unnecessarily, and use the mode of transportation that is recommended and not unnecessarily use other transportation.
Our last question for today. If the home quarantine is 4 days and the test is done on the 4th day, given the backlog, what can be done to expedite as persons in quarantine and test negative obviously would need to move on, and the wait is very frustrating? Would they still have to wait a 5th or a 6th day until backlog issues are resolved? Persons are complaining about delayed results.
I would have indicated previously in my presentation that a person can only be released from quarantine after receiving a negative RT-PCR test. So if there's a backlog for whatever reason and you have to wait, we apologize in advance for the inconvenience for the wait, but it will be worth it. You can only be released from quarantine if you receive a negative RT-PCR test.
That brings us to the end of our question and answer for today. Thank you very much for your questions. And of course, you can always submit your questions, if you still have questions, at another press briefing. I want to thank Ms. Leonie James for her generous donation to the NEOC. There are very conscious people out there who are supporting this fight against the COVID-19 pandemic, not just through vaccination, not just through the non-pharmaceutical measures, but really putting their money where their mouth is, because they recognize that this management of the COVID-19 pandemic comes at a cost to the country. When you have people ending up in the hospital, it comes at a cost to the government. It's an economic cost to the whole management of the COVID-19 pandemic. I want to thank Superintendent Henry for his presentation, Dr. Marissa Carty for her presentation of the HEOC situation report, and Mr. Abdias Samuel. I also thank the Honorable Wendy Phipps for her continued support here at the NEOC. I also want to recognize among us the Miss Michelle Rodriguez. I hope I'm pronouncing it correctly. And she is the new Public Relations Officer at NEMA. She replaces Vesta, and we thank Vesta very much, and I miss Vesta very much. She's a good sport. I really miss her. I thank the ZIZ and all the media houses who continue to partner with us in this fight against the COVID-19 pandemic by presenting information that is factual, information that is official, and information that is credible. They are working in the fight against the misinformation and disinformation that we still have. Thank you to Mrs. Christmas Jacobs. How can I forget you? Because you provide a very vital service here in terms of an important group among us with your service of sign language. Thank you to all of you for joining us today for our press briefing. We will be back next week, Wednesday. Until then, take good care, get vaccinated, and follow the non-pharmaceutical measures of wearing your mask, the social and physical distancing, and the hand hygiene. I am Les Roy Williams.